And welcome to our Farm to Home segment with registered pharmacist Thomas McDowell. Glad to have you here,
Sandra. Glad
as
to be here.
always. And I think we're getting some response from your being here. We're glad people are learning things, and that's what we try to do, is educate and inform on this program. And you're certainly bringing information that we can do that. So, what are we talking about?
So yeah, we've had some good response from this topic just at our last segment a couple of weeks ago, and so we're going to continue into another aspect of this program, but we're going to talk about remote patient monitoring, or RPM for short. So remote patient monitoring is a new program at Medical Park Pharmacy and McDowell's in Scotland Neck. It's for patients with either diabetes or high blood pressure. And through this program, we have a brief consultation with you, review your medical history, your medications, and we are able to provide you with a free blood pressure or blood sugar monitor, depending on what your needs are and whether you have diabetes or high blood pressure. So a free monitor and free supplies if you're testing blood sugar. And
so if they have both, can they get two monitors?
Yeah.
Okay.
We're mainly kind of focused primarily on what the biggest need is,
okay.
and have had more focus on blood pressure at first, but really trying to open things up to the folks with diabetes now. And so when they get that monitor, they go home, we set them up with it, they check their blood pressure or their blood sugar. We get those readings within just a couple of seconds back at the pharmacy. So some neat technology there, runs on a cellular gateway, and so that allows us to keep track of the readings for that patient remotely. And if we get any concerning readings, we can call and check in with you, communicate to your primary care provider, and each month we actually send a report to the patient's primary care provider with all of their readings. And any notes, so that the provider has that information to make decisions on your plan of care.
I would suggest you sign up for this if you have high blood pressure or diabetes, or that is just awesome that you can provide, because people, I hear all the time the doctors ask for the readings. What are your readings in your meter? I don't know. I don't keep up with it.
Yeah,
I don't have a
monitor, and I don't.
So how does the doctor know what your average is? Well, I know there's blood tests, but how do they know what your average is with blood pressure and all of that?
Yeah, especially with blood pressure. Not many folks have some people have a blood pressure monitor, but not a lot of folks do. And even if they do have one, they're not checking it. They don't know what readings to look for. They're not really managing it themselves. They're usually waiting to go see the doctor, get their blood pressure checked in. And one of the issues that is pretty prevalent when you go to the doctor and have your blood pressure checked is white coat hypertension. You're nervous.
Right.
You're on edge a little bit, and you want to have a good blood pressure that can cause some stress and elevate your blood pressure. So,
right.
With that reading, it might not necessarily be accurate for you when you're stable.
And if that's the only one the doctor's seeing, and
it's hard to work with.
It's the day you've been to the doctor, he needs to see more.
Yeah, and they might, it's hard to decide there, okay, should we prescribe you a new blood pressure medication, or are you just nervous? Because everybody's blood pressure is going to go up at times.
Sure.
But we're more concerned about consistently elevated blood pressure. That's what puts you at higher risk of stroke, heart attack, kidney disease. It's not usually the random slight elevations.
Mm-hmm.
Everybody's going to experience that through exercise, stress, caffeine. And so we're looking for a more consistent viewpoint on the readings. And in this program, you do have to check at least 16 days out of the month to be in the program. We, ideally you check every day, but that gives us a really great, data. It gives a lot of great data that the provider can look at, and not just that one reading at the office. And so we're really hoping that it'll be beneficial to our primary care provider partners that we're working with. We're letting them know about this program, have had great reception from them about it. And when we ask them, hey, do you have some patients that have high blood pressure and that are having trouble controlling it? Oh, yes.
Right.
Is always the answer. And so we have the ability to to help, coordinate care.
Yes.
We're not changing any medications or any doses. We're just looking at those readings, and if we see an elevated reading, we can call you and, hey, have you taken your blood pressure medication
Sure.
today, or what's going on? And maybe it's just your stress that day, or you've had 3 cups of coffee this morning and
Right.
you normally only have 1. And so, and then if we see a trend of concerning readings, or a really elevated reading at one time, we can talk to your primary care provider for you and communicate, and they can potentially change something if they feel that there's a need for a change, or bring you in, or talk to you. So really kind of connecting the dots, and we all know that it's sometimes hard to get into primary care, and it's they're really busy seeing a lot of patients, and so we can kind of help monitor some of your
Sure.
your disease states while you're in between appointments, and that sort of thing. And so last time we talked about primarily the blood pressure monitoring, and so today we wanted to talk a little bit more about the blood sugar monitoring, a different device, but same concept. Free monitor if you sign up for this program. You have to have Medicare or Medicaid, and/or Medicaid. So we are able to take anybody into the program that has Medicare or Medicaid, except Humana Medicare Advantage. That's the only one, only caveat, and it's covered at no cost by almost every Medicare plan.
Mm-hmm.
And so it's, for most patients, there's no cost to the program whatsoever.
Right.
So ton of value there. There's just the free monitor, you're getting value there, and then you have a pharmacist checking in and monitoring your readings. So a lot of value there too, because it's hard when you have questions about what's going on.
Right.
What do I do? My blood pressure is 160 over 90. I know that's higher than the doctor told me it needed to be. What do I do? And now you have somebody you can talk to about that.
So you would you've got to take your blood pressure at least 16 times that month, but you should be monitoring more
Yeah.
than that. And it goes directly to
To the
Rocky
pharmacy.
Mountain Medical Park Pharmacy. Y'all stay innovative. Y'all are always coming up with new things and new ways to help the patient.
Well, we're excited about this one, and you're right. We're always trying to add value, and we really believe we can be a safety net and a health hub for folks in the community. We're the most accessible healthcare provider. 99% of the time, you can access us easier than any
Right.
other provider. You can walk in and talk to us. You can call and get the pharmacist really quickly. And so we're able to troubleshoot and just monitor folks in this program very effectively because of that access.
And prevention is very important. And I look at this as a preventive measure. In case your blood pressures do start getting elevated, you could possibly prevent a heart attack, a stroke, as you said,
Yeah.
kidney disease, all of that. So it's a
Absolutely.
preventive measure for you. So
Yeah, and that's exactly right. Some patients are seeing the doctor maybe once or twice a year,
Yeah.
and maybe quarterly, depending on how complex their conditions are. But there's a lot of time in between that. And if your blood pressure's staying elevated and you're not aware of it, you are putting yourself at risk for some potential acute issues like stroke or heart attack, especially over a long period of time. So definitely a preventative nature to this. And this program, patients in this program typically have better blood pressure or blood sugar control, less medication issues, and less visits to the hospital. And so not many people want to go into the hospital.
Right.
And so, it's adding a lot of value, and really you can take ownership of your health and prevent a lot of unnecessary issues and,
Right.
and conditions and hospital visits. And so covered by
and
insurance.
possibly making you take it more than you normally would, because you know to be in the program
Yeah.
you need to do this. So you're really taking it more than, because people are busy and they don't think about things, or they don't have time. But this kind of forces you to know what's going on with your body.
You kind of got that accountability buddy,
Yes.
when you're thinking about going to the gym and you're doing it by yourself, it can be hard to stick with it.
Right.
Because you don't have anybody to bounce thoughts off of, or anybody to encourage you, and so you have a partner in health when you're in this program, and we're gonna. If we see you're not checking your blood pressure for a couple of days, we're going to call you and, hey, what's going on? And check in with you, and just, we want to help. And so we're really excited about it. And, we've started out mostly with blood pressure, patients with high blood pressure, but we can also help patients with diabetes. And we've talked about diabetes and the burden that disease state has in the United States. Pushing close to 20% of the population has diabetes or prediabetes. And so most patients that are diabetic are already testing their blood sugar. And so this is just a simple swap out the monitor. Right. And so really easy, and a lot of people are paying for their strips and Lancets and their monitor. We're providing all that for free. And so you're saving money by not having to pay copays on your test strips and your Lancets to prick your finger. And so we provide you with the device. We get the blood sugar readings remotely, and we can really guide you. And the blood sugar can be a lot more complex. There's what should your fasting value be? What should your postprandial after meal numbers be? It can be a lot more complicated even than blood pressure. So we're really excited to start opening. Have more patients enroll and opening things up for our diabetic patients. And one of the cool things is you don't have to get your prescriptions filled at Medical Park Pharmacy. Would love if you did, but you don't have to. This program's open to the community, anybody with Medicare and or Medicaid except Humana Medicare Advantage. But any other Medicare Advantage plans are fine, United, Aetna, Blue Cross. Any of those major ones we can take those, usually no cost. And so you can just walk right in, and usually we can help you right when you walk in. But if we're already helping somebody else, we can schedule an appointment. So we'd encourage you to call us at 252-443-7979, Medical Park Pharmacy, 901 North Winstead Avenue in the Medical Park building right there on the first floor. And we can help enroll you in this program, and our patients have loved it. We've made a lot of great interventions. We've had a lot of interventions where we've seen some really highs and some lows. We've communicated to the provider. There have been some dose changes. And
it can be low too, like you just said. We keep talking about highs, but it can be lows. Too. Yeah, absolutely.
And we're monitoring the heart rate as well, and so with those lows, we've seen some under, systolic under 100, so 80 over 50, really low, and that's concerning, for patients, because that can cause dizziness and a fall maybe in the elderly, and so you really have somebody monitoring things for you. So our patients have loved the program. Providers have been very receptive and appreciate the data and the communication. And so would encourage you to come by and see us and enroll in the program, and we're really excited about it.
That is great. And like I said, another great thing that you're doing, y'all always have the patients in mind and the patient's best interest in mind. When you go to the big box stores, they're just going to fill the prescription. They're just going to fill the prescription. That's what they're there for, to fill the prescription. So, but it goes beyond that at Rocky Mount Medical Park Pharmacy. So we hope that you will call Thomas, call the staff down there, 443-7979. There's the number, and or just go down there. Just walk into the Boyce Willis building and... Yeah,
we had somebody, I was telling Roger, we talked about it last segment. We had somebody that day, they didn't get their prescriptions filled with us. They walked in, we enrolled them right there on the spot. Usually takes 20 minutes to get you all set up. And then after that, everything's going on remotely. You're not required to come into the pharmacy.
Right.
You have your device, you're at home, you just have to check 16 days out of the month. And we're calling you and communicating by phone, so it doesn't matter where you live. It doesn't matter what county you're in, what town you're in. It just matters, if you have one of these disease states, hypertension, high blood pressure, or diabetes, typically type 2 diabetes, and that you have Medicare and or Medicaid. That's really the only requirements. And so you can drive and come into us and see us, and we're working on, in the future, we're going to be going out into the home for our homebound patients.
Wow.
To enroll them if they can't get to the pharmacy, set them up with the device, communicate with them, educate them, and then everything from there is remote. And so we're working on that, and we've already done some of that, but that's going to be really exciting in the future to help some folks that might not be able to get into the pharmacy.
Well,
So,
remember, they do deliver.
that's right. So we do
to
deliver
a pretty wide area,
Yes.
actually.
So we deliver all throughout Rocky Mountain in our MacPack program, our adherence packaging, pill packs, where we sort your meds by date and time. We deliver throughout Nash County, Edgecombe, Halifax, some in Wilson, Martin, and Northampton.
Wow.
So, and that's through our MacPack at Home program. Usually 5+ medications, and for folks that might have some transportation limitations or mobility issues, and we can come to you, deliver your package for free, and no extra cost. You just pay your normal copays. So that's a program we've been doing for a while and continues to grow, and really can help keep you out of the hospital and relieve that medication burden from you.
Absolutely. Well, thank you, Thomas, for coming today again and giving us some great information. We'll see you back in 2 weeks, I think, and we'll see what he has in store then. So
Right.
check it out. There's the number if you want to call or walk into the Boyce Willis building, 901 Winston Avenue, I believe it is.
Yep. We open at 9, so give us a call, and we'd love to help you with our new RPM program.
It's right there on the first floor, easily accessible. We'll be right back right after this.